If you're over 50 and waking up multiple times every night to urinate, if you're standing there waiting for your stream to start, feeling like you can never fully empty your bladder, I need you to hear this. You're not broken, and you don't have to just accept this as part of getting older. What's actually happening inside your prostate isn't what most men think. It's not just about size. It's about inflammation and something called DHT that's making your prostate tissue react and tighten around your urinary tract like a slowly closing fist. I'm Dr. Ava Thompson, and today I'm going to explain exactly why your prostate symptoms get worse at night. The one plant extract that clinical studies show can reduce nighttime bathroom trips by up to 50% in 12 weeks. And the 3 critical mistakes that make most men waste their money on supplements that never work. I'll show you the exact form and dose that's been studied, not the cheap versions that do nothing. And I'll explain the one evening habit that's sabotaging your results even if you're taking the right supplement. But here's the thing. 70% of men quit before their prostate tissue has time to respond. So if you want to understand what's really happening and how to support it the right way, stay with me. Your sleep and your confidence start right here. If you're over 50 and waking up to urinate multiple times every night, I want you to know something right away. This is not your fault. I see this in my practice constantly. Men come in looking exhausted, frustrated, even embarrassed, and they tell me about their nights. Getting up once, twice, sometimes 3 or 4 times to use the bathroom, never getting that deep, restorative sleep they used to have, feeling like their body is betraying them. I had a patient, 62 years old, who finally admitted to me that he'd started avoiding going places with his wife. Not because he didn't want to spend time with her, but because he was always calculating where the bathrooms were, always worried about that sudden, urgent need to go. He felt like his life was shrinking around this one issue. And here's what he said that really stuck with me. "Doc, I thought this was just part of getting old, that I just had to accept it, but that's not true. And I need you to hear this clearly. Stop normalizing suffering. Yes, prostate symptoms after 50 are extremely common. Over half of men over 60 experience them. But common doesn't mean you have to just live with it. Symptoms are signals, not destiny. Your body is telling you something needs support. And when you listen to those signals and respond appropriately, things can improve significantly. But what's actually causing the prostate to change in the first place? Let me tell you about the silent prostate changes most men aren't warned about. Prostate enlargement, what we call benign prostatic hyperplasia, or BPH, often begins years before you notice any symptoms. The prostate is a small gland that sits right below your bladder, surrounding the urethra. That's the tube that carries urine out of your body. Think of it like this. Imagine a garden hose with a ring slowly tightening around it. At first, the water flows fine. You don't notice anything different. But as that ring gets tighter and tighter over time, the flow starts to weaken. It becomes harder for water to get through. That's essentially what happens with prostate enlargement. As the gland grows, it gradually narrows the urethra, and that creates all those symptoms you're experiencing. Weak stream, difficulty starting urination, that feeling like you can't completely empty your bladder, and yes, waking up multiple times at night. But here's the key. Early awareness leads to more natural, conservative options. When you catch these changes early, before they become severe, you have a lot more tools available. You don't necessarily need surgery or aggressive medication. You can often manage symptoms with lifestyle changes, targeted nutrition, and natural supplements. And aging alone isn't the real villain here. I need to explain something that most doctors don't emphasize enough. Why aging gets blamed, but inflammation is the real driver. Yes, prostate growth is associated with aging, but it's not age itself that's causing the problem. It's what happens in your body as you age that matters. And one of the most significant factors is chronic low-grade inflammation. Inflammation is your body's response to irritation, injury, or stress. And when it's acute, when you cut yourself or sprain an ankle, inflammation is helpful. It's part of healing. But chronic inflammation, the kind that simmers quietly for years without you realizing it, that's different. That accelerates aging and disease throughout your entire body. And in clinical practice, I see a very clear pattern. Men with metabolic inflammation, Men with high blood sugar, excess abdominal weight, elevated inflammatory markers in their blood, they show worse urinary symptoms. Their prostates tend to be more reactive, more symptomatic, even when the size isn't dramatically different from someone else's. So the key is to address inflammation early, not just focus on hormones or prostate size. When you reduce overall inflammation in your body, prostate symptoms often improve as a natural side effect. This is where certain medicinal plants enter the conversation. And I know what you might be thinking. Can a medicinal plant really help the prostate? Isn't that just folklore or marketing hype? Here's what I tell my patients. Some plants don't shrink organs magically. That's not how they work. But they can change biological signaling. They can influence the pathways that control inflammation, hormone metabolism, and tissue reactivity. And one plant that's been clinically studied for prostate health is saw palmetto. Now, I'm not going to tell you it's a miracle cure. It's not. But there is legitimate research showing that when used correctly, saw palmetto can help reduce symptoms in men with mild to moderate BPH. The key phrase there is when used correctly, because most men don't use it correctly. They buy whatever's cheapest at the supplement store, take it inconsistently, and then wonder why it doesn't work. But when you look for evidence, not just folklore, and you use the right form at the right dose consistently, saw palmetto can be a valuable tool. So, what does the science actually say? Let me break this down simply. First, you need to understand what the prostate actually does and why it grows after 50. The prostate is part of your reproductive system. It produces fluid that nourishes and transports sperm. And throughout your life, the prostate responds to three main things: hormones, inflammation, and blood flow. When you're younger, these systems are balanced. But as you age, things shift. Testosterone, your main male hormone, gets converted into a more potent form called DHT, or dihydrotestosterone. And DHT has a strong effect on prostate tissue. Here's the simple breakdown. DHT signals prostate cells to grow, and over decades, that growth accumulates. By the time you're in your 50s or 60s, your prostate might be 2 or 3 times larger than it was in your 20s. Now, growth doesn't equal cancer. This is benign enlargement. It's not malignant. But symptoms still matter because even benign growth can significantly impact your quality of life. And DHT isn't acting alone. Let me explain how DHT, inflammation, and the urinary bottleneck all work together. DHT doesn't just make the prostate bigger, it also thickens the tissue. It makes the gland denser, less flexible, and at the same time, inflammation stiffens the prostate. It increases the reactivity of the smooth muscle in and around the gland. Now, smooth muscle is different from the muscles you control voluntarily, like your biceps. Smooth muscle is involuntary. It's in your blood vessels, your digestive tract, and yes, your urinary tract. And when the smooth muscle around your bladder neck and prostate becomes tight, it creates additional restriction beyond just the physical size of the gland. This is why some men with relatively small prostates have severe symptoms, while other men with larger prostates have mild symptoms. It's not just about size, it's about how inflamed and reactive the tissue is. And here's the practical takeaway. Reducing inflammation often improves flow before you see any change in prostate size. You can feel better weeks before any measurable shrinkage happens, simply because the tissue becomes less irritated and the smooth muscle relaxes. This is where saw palmetto's real power shows up. Let me explain how saw palmetto actually works, not the myth version you might have heard. Saw palmetto doesn't dramatically shrink the prostate. That's the myth. What it actually does is block local DHT activity and calm inflammatory signals in prostate tissue. Think of it this way. DHT is like a signal telling prostate cells to grow and become more reactive. Saw palmetto partially blocks that signal at the tissue level. It doesn't lower your overall testosterone or DHT levels in your blood. It just reduces how strongly prostate tissue responds to DHT. At the same time, saw palmetto has anti-inflammatory properties. It helps calm the chronic low-grade inflammation that makes prostate tissue more symptomatic. And studies show that men taking saw palmetto often experience symptom improvement even without dramatic size reduction. What improves? Urinary flow becomes stronger. Nighttime urgency decreases. The feeling of incomplete emptying gets better. These are functional improvements, not just anatomical ones. The benefits are functional first. Better flow, less urgency, fewer times waking up at night. That's what matters for your quality of life. But most men use it incorrectly, which is why results are so inconsistent. Let me tell you why some men see real results and others see absolutely nothing. Quality, dosage, and consistency determine outcomes. And the difference between clinical studies and supplement store anecdotes often comes down to these three factors. In research studies, they use specific formulations at specific doses taken consistently over specific timeframes. They're using standardized extracts with known concentrations of active compounds. They're tracking compliance to make sure people are actually taking it every day. But in the real world, men buy whatever brand is on sale, take it sporadically, and expect results in a week. And then they conclude saw palmetto doesn't work. The truth is, standardized extract matters way more than brand hype. You need to know what you're actually getting in each dose, and you need to take it consistently for long enough to see benefits build. Let me break down the biggest mistakes I see in my clinic, because understanding these will save you time, money, and frustration. I'll show you the exact form and dose that's been studied, not the cheap versions that do nothing. And I'll explain the one evening habit that's sabotaging your results even if you're taking the right supplement. But here's the thing, 70% of men quit before their prostate tissue has time to respond. So if you want to understand what's really happening and how to support it the right way, stay with me. Your sleep and your confidence start right here. The first mistake is one of the most common, and it explains why so many men tell me saw palmetto didn't work for them. Taking the wrong form of saw palmetto. Here's what happens. Men go to the supplement store, they see saw palmetto on the shelf, and they grab whatever's there. Maybe it's powdered berries. Maybe it's some generic capsule with no standardization listed. But powdered berries are not the same as clinically effective extracts, not even close. The studies that show benefits for prostate symptoms use something specific. They use liposterolic extracts. These are concentrated extracts that contain standardized amounts of fatty acids and sterols, which are the active compounds that actually influence prostate tissue. A liposterolic extract is typically standardized to contain 85 to 95% fatty acids and sterols. That's what gives you consistent, measurable effects. Random powdered berries? The concentration of active compounds varies wildly. You might be getting something helpful, or you might be getting almost nothing. The actionable fix? Look for 320 milligrams of standardized extract. That's the dose used in most clinical trials. And make sure the label specifies that it's a liposterolic extract standardized to at least 85% fatty acids and sterols. If the label doesn't say that, you're probably wasting your money. But even the right form can fail if your timing is wrong. This brings me to mistake number 2. Expecting results in days instead of weeks. I cannot tell you how many times a patient has told me, "Doc, I took saw palmetto for 5 days and nothing changed, so I stopped." And I have to explain to them that's not how prostate tissue works. Your prostate doesn't respond to supplements the way a headache responds to aspirin. This isn't about immediate symptom relief. This is about changing biological processes over time. Prostate tissue responds slowly. The inflammation pathways we're trying to calm, they take 6 to 12 weeks to show measurable changes. The reduction in tissue reactivity, that's gradual. The improvement in smooth muscle tension, that builds week by week. Most men in clinical studies start noticing symptom improvement around the 6 to 8 week mark. Some notice small changes earlier, but the real benefits, the sustained improvements in flow and nighttime frequency, those typically show up between 8 and 12 weeks. The fix? Track your symptoms, not just your urgency to see results. Keep a simple log. How many times are you waking up at night? How strong is your urinary stream? How often do you feel that urgent need to go during the day? Write it down weekly. And then at 8 weeks, at 12 weeks, look back at where you started. That's where you'll see the real pattern of improvement. But here's the thing, supplements cannot outwork bad habits. And that brings me to mistake number 3, Ignoring diet and nighttime triggers. I had a patient who was taking saw palmetto religiously. Good quality extract, right dose, perfectly consistent. But he was still getting up 4 times a night, and he couldn't understand why. So I asked him to walk me through his evening routine, and here's what he told me. He'd have 2 or 3 beers with dinner around 7 or 8 p.m. He'd drink a big glass of water before bed because he'd heard staying hydrated was important. And his diet was heavy on processed foods, fast food, things high in sugar and inflammatory oils. And I had to tell him, you're working against yourself. The saw palmetto is trying to reduce inflammation and calm your prostate tissue. But alcohol, especially in the evening, irritates the bladder and prostate. It increases nighttime urine production. It disrupts the quality of your sleep. Late fluids of any kind, even just water, fill your bladder right when you're trying to sleep. And ultra processed foods drive systemic inflammation, which makes prostate tissue more reactive. After we made some simple changes, cutting out evening alcohol, stopping fluids 2 to 3 hours before bed, cleaning up his diet a bit, he noticed a dramatic difference. Within 2 weeks, he went from 4 bathroom trips a night to 1 or 2. The saw palmetto was finally able to work because he wasn't sabotaging it every evening. The fix is straightforward. Stop fluids 2 to 3 hours before bed. Cut back significantly on alcohol, especially in the evening, and reduce processed foods, added sugars, and inflammatory oils in your diet. You don't have to be perfect, but you have to stop actively making things worse. Now, there's one final mistake that stops progress completely, and this one is actually the most important: using plants instead of medical guidance. And I need to be very clear about what I mean by this. Natural doesn't mean you should ignore red flags. Saw palmetto is safe for most men when used appropriately, but it's not a substitute for proper medical evaluation, and it's not appropriate for every situation. There are warning signs that require immediate medical attention. If you're experiencing pain with urination, if you see blood in your urine or semen, if your symptoms are rapidly worsening, if you're having difficulty urinating at all or you can't empty your bladder, these are red flags. You need to see a doctor, not just take a supplement and hope it resolves. Saw palmetto is for mild to moderate symptoms in men who've been evaluated and know what they're dealing with. It's support, not avoidance. I've had men come to me after months of trying to self-treat with supplements when they actually had something more serious going on. Severe obstruction that needed intervention, prostate cancer that needed to be caught early, bladder stones, urinary tract infections that had become chronic. So use plants as support, not as a reason to avoid proper medical care. Get evaluated, know what you're dealing with, and then use saw palmetto as part of a comprehensive approach that includes medical guidance. So how do you actually implement this safely and effectively? Let me give you a simple daily routine that supports prostate health in a realistic, sustainable way. Consistency beats intensity. You don't need a complicated protocol with 15 different supplements. You need a few key things done consistently over time. Here's an example routine that many of my patients follow successfully. In the morning, with breakfast, take your saw palmetto, 320 milligrams of standardized liposterolic extract, and take it with some dietary fat, maybe eggs, avocado, nuts, olive oil, because saw palmetto is fat soluble. It absorbs better when consumed with fat. Throughout the day, focus on anti-inflammatory meals. More vegetables, especially cruciferous vegetables like broccoli and Brussels sprouts. More omega-3 rich foods like fatty fish, walnuts, flax seeds. Less processed food, less sugar, less refined carbohydrates. Stay well hydrated during the morning and early afternoon, but start tapering your fluid intake as evening approaches. Maybe have a light dinner by 6 or 7 p.m. Stop all fluids by 7 or 8 p.m. and create a calming nighttime routine that supports good sleep. Because when you sleep well, inflammation goes down, stress hormones normalize, and your entire system functions better. That's the routine. It's not glamorous, it's not complicated, but it works because it addresses all the factors that influence prostate health. Hormone signaling through the saw palmetto, inflammation through diet, nighttime symptoms through fluid timing and sleep quality. But progress depends on patience. Let me tell you what realistic improvement looks like over 90 days, because this sets appropriate expectations. In the first month, you might notice subtle changes. Maybe you're waking up one less time at night. Maybe your stream is slightly stronger. Maybe the urgency isn't quite as intense. These are small wins, but they matter. By month 2, improvements become more noticeable. You're consistently waking up less, your flow is definitely stronger, you're not feeling that constant need to locate the nearest bathroom when you're out. Your quality of life is improving in measurable ways. By month 3, the benefits have built on each other. Many men at this point are waking up just once or not at all. Their daytime symptoms are manageable or minimal. They feel like they've regained control over something that had been controlling them. This is the realistic timeline. Not 3 days, not even 3 weeks, but 3 months of consistent effort. My advice? Reassess at 8 to 12 weeks. Look at your symptom log. Compare where you are now to where you started. And if you're seeing meaningful improvement, keep going. This isn't a temporary fix. This is a long-term support strategy. And remember, this is about control, not perfection. You're not trying to have the prostate of a 20-year-old. That's not realistic. You're trying to manage symptoms so they don't interfere with your sleep, your confidence, your ability to live your life fully. Now, I need to talk about when supplements are enough and when they're not. Mild to moderate BPH often responds really well to this kind of approach. Men with early symptoms, men who are getting up once or twice a night, men with some flow issues but no severe obstruction. They're the ones who tend to get excellent results from saw palmetto combined with lifestyle modifications. But severe cases need combined strategies. If you're getting up 5 or 6 times a night, if your flow is extremely weak or you're having trouble emptying your bladder at all, if you've developed complications like bladder stones or chronic retention, supplements alone probably aren't going to be enough. In those cases, you might need medication. Alpha blockers that relax the smooth muscle, or 5-alpha reductase inhibitors that actually shrink prostate tissue over time. Or in some cases, you might need a minimally invasive procedure or even surgery. And that's okay. The goal isn't to avoid all medical intervention. The goal is to use the least aggressive approach that gives you meaningful symptom relief. Know when to escalate care. If you've given the natural approach a fair trial, 12 weeks of consistent effort, and you're not seeing adequate improvement, it's time to talk to your doctor about other options. Don't suffer unnecessarily trying to avoid medication or procedures that could genuinely help you. Here's the message I want every man over 50 to hear. Aging doesn't mean losing comfort or confidence. It doesn't mean accepting a life where you're constantly worried about bathroom access, where you're exhausted from broken sleep, where you feel embarrassed about your body's changes. Prostate changes are manageable. With the right information, the right support, and the right medical guidance, you can maintain quality of life. You can sleep through the night, you can travel without anxiety, you can feel confident and comfortable in your own body. This isn't about denying that aging happens. It's about refusing to accept unnecessary suffering as inevitable. It's about taking informed action to support your body through these changes. I encourage you to have informed conversations with your doctor. Bring your symptom log. Ask about saw palmetto and whether it's appropriate for your situation. Be honest about what you're experiencing without shame or embarrassment. And commit to consistent habits. Not perfect habits, but consistent ones. The daily supplement, the dietary improvements, the fluid timing, the sleep routine. These small things done consistently create meaningful change over time. Remember, you have more control here than you think. You're not powerless. You're not just at the mercy of aging. You have tools, you have strategies, and you have the ability to improve how you feel. If this information gave you clarity, if it helped you understand what's actually happening and what you can do about it, please subscribe. I share evidence-based guidance on men's health because I believe you deserve real information. Not fear tactics, not empty promises, just honest, practical advice based on clinical experience and research. Take care of yourself. Your prostate changes are normal, but they don't have to control your life. With the right approach, you can age with dignity, comfort, and confidence. Start with one small change this week and build from there. I'll show you the exact form and dose that's been studied, not the cheap versions that do nothing. And I'll explain the one evening habit that's sabotaging your results even if you're taking the right supplement. But here's the thing: 70% of men quit before their prostate tissue has time to respond. So if you want to understand what's really happening and how to support it the right way, stay with me. Your sleep and your confidence start right here.